etc., etc. And this has led to a plethora of organizations and books who are pretty much based on hatred of AA. And you can usually identify them by reading them, and they say, we have the solution, AA is not the solution, by the way, send us a check. I've never seen one of these organizations offer to do it without some kind of remuneration. So let me give you a different take on this. So I'm an OBGYN, and I actually used to do GYN cancer surgery. These are two pictures of ovarian tumors. They're both women who are 45 years old, and these tumors are both about this big, okay? The one on the left has no family history. The one on the right has a family history of breast cancer. The one on the left has no genetic predisposition. She tests negative for all the cancer genes. The one on the right has the BRCA gene, BRCA, which gives you breast and ovarian cancer. Now, I don't know these patients. These are slides I took off the internet. But I can tell you with reasonable certainty, the one on the left did not die from that tumor, and the one on the right is dead from that tumor. Okay? Because the one on the right has the family history and the genetics, and that's what we call an epithelial ovarian cancer. And when I put these two slides up and I show these to OBGYN residents, and I take the information off the top, they usually can't tell me which one is which. And that's what addiction and abuse is. They act the same, but when you look at it, one has a family history, one has the genetics, and one can be a lethal disease. The other one is just you're acting like a schmuck, okay? Now, if I took this statement and I said, for every ovarian cancer, there is 100 benign tumors, thus ovarian cancer does not exist and we should stop worrying about it. You would do the right thing. You would call Lansing and have my medical license suspended because I'm an idiot, okay? But people do this all the time. They say, most people can quit drinking, therefore alcoholism does not exist. It does. When you hear that, don't worry about it. It is stupidity. That's really all you can call it. That's an opinion. And Mark Minestrina, who probably detoxed about 20,000 people at Brighton Hospital, he has a great statement I stole. Abuse is a behavior, addiction is a true disease. And that's what differentiates them. Now, let's talk about the next problem, relapse. Every patient I meet who wants treatment for their addiction will tell me initially, if I can just get through the withdrawal, if I can just get over the Vicodin, over the alcohol, over the Xanax, I'll be okay. They don't recognize there's more going on. And when I tell people that if they stop doing their treatment, their 12-step, their counseling, their medication, they're going to relapse, I am always told, don't worry, that will never happen to me. Everyone who relapses says, don't